Hey there, I'm Dr. Sloan. I'm one of the chiropractors here at Arizona Pain Relief. We're located in sunny Phoenix, Arizona. It's getting to that time of year where families are trying to get out, hang out with their friends, and just be super active. And we at Arizona Pain Relief are invested in our patients being able to do fun things and have fun with their family. Here in Arizona, we have over 200 golf courses. I personally love to golf. I know most of the guys I work with like to golf as well. And what we've seen is a lot of our patients come in with golf-related injuries. Low back pain, hip pain, knee pain, you name it, they've got it, and they always blame their bad scores on their pain. So we're here to help you not get sandbagged by your friends. Okay, one of the other injuries we see a lot of the time is elbow pain. It's called golfer's elbow, and it happens because people end up overusing their arms while they're swinging, gripping too hard, or high-fiving too hard. There's a lot of things that can cause the pain in their arm. So we're going to chat today a little bit about the biomechanics of the elbow pain and what we can do to alleviate that at home and what we can do in our clinics to help you guys. Let me show you what I'm talking about. Come on with me. So like any self-respecting doctor, I have my golf clubs here at the office. Let me show you what golfer's elbow is really about. You know what? Let's go somewhere more appropriate. Oh man, that is way better. We're in the beautiful city of Chandler at San Marcos Golf Resort. We're on the 13th hole, the signature hole. Some people say Al Capone might have stayed in that house down there at some point. We are here to go over the golfer's elbow, which many of you suffer from. So what is golfer's elbow, right? Many of you guys that are out there playing golf, one of the most common injuries that we get is pain in the elbow. And that actually happens because of all the muscles that we use to grip our arms are right over here, and they attach right at this point here. So we end up getting pain from our gripping muscles. So as our trail arm comes through the golf shot, we end up gripping super hard, which is normal, but we're really tensing up this attachment point over here. Now the problem with it is when we start to play golf and we haven't played in a while, we go out and we hit golf balls. We hit buckets and buckets of golf balls, 70, 80 golf balls. And then what do you do after that? You hit another 70 or 80 and you do it day after day after day, and it causes an overuse injury. So this muscle starts to tighten up, this attachment point gets really irritated, and you start to develop pain. And what do you guys do right after that? You go hit some more golf balls. Yeah, you do. Another bucket or two, and then you complain to your wife about how much your elbow hurts. And you complain to your buddies saying, man, I can't play, or if you guys beat me today, it's because my elbow hurts. Here's the reality. The best thing that you can do, and it's the thing I know you won't do, that is take time off from hitting golf balls. So take 2 weeks off, rest your arm, stretch your arm out, and you'll feel better. Now, knowing that you won't do that, the other things that you can do are stretching your forearm, right? One of the ways we can stretch it out is just kind of open it up here, stretch the forearm. You could place it against a wall and stretch it out. The other thing that's actually really important is icing the elbow. Putting some ice on there, make sure there's a towel between the skin and the ice so you don't burn yourself. Ice that for about 20 minutes, 3 or 4 times a day. You can also take some over-the-counter anti-inflammatory medication to help reduce inflammation. You can also get a medial epicondylitis or golfer's elbow brace and put it on here to help support the tissue there. One of the things you can do is look at how hard you're gripping your club. Make sure you're not gripping it too hard. And again, the thing that'll help the most is time away from the game. So when it comes to golfer's elbow, a lot of times the pain that you're going to experience is dull, achy, deep pain in the forearm. It can also be pretty sharp at the attachment point where it's really inflamed. You can also see some swelling in the elbow. So because like I said, I know you guys are not going to stop golfing, you're not going to stop playing. At some point your home remedies are going to stop working. The icing, the ibuprofen, the stretching is just not going to do the trick anymore. That's when you're going to call Arizona Pain Relief. Our doctors are trained in treating all types of tendonitis, and we have multiple different therapies that we can utilize. We can use stretching and exercise, we can use chiropractic adjustments, medical interventions from trigger point injections all the way to joint injections if needed. So when you're having these issues, give us a ring and we can get you in, get a consult with our specialists and see what we can do to help you out. Typically, once we've got the pain and inflammation under control and we strengthen and increase the flexibility of the forearm, you're gonna be feeling a heck of a lot better. We'll get you back out there to play some golf. The only problem is, because you're gonna be feeling good, you won't be able to blame your crappy golf game or your low score on your elbow. So one of the other things that we've noticed with most of our patients that have an elbow injury is they're typically compensating for other biomechanical limitations. So let's just say their shoulder isn't able to move properly. They don't have an ability to externally rotate their shoulder. When they come through to swing, they kind of start cheating by rotating their forearms a lot harder. Same thing can be said for if they have low back tightness or low back stiffness or hip tightness or hip stiffness. When they're trying to swing, they can't really turn their body properly. And so to get a good shot, they overdo it with their forearms and create more force and torque into their arm, creating an overuse injury. So one of the things we do at Arizona Pain Relief is when you come in with an elbow injury, we don't just look at the elbow exclusively. We'll look at the shoulders, we'll see how your mobility is there, we'll check your lumbar spine, your thoracic spine, and your cervical spine, make sure that all of those parts of your body are moving well as well. Also the hips and the knees. Once we have a good clinical picture of what's going on, we can help fine-tune these other areas to improve your mobility throughout your musculoskeletal body and then help reduce an overuse injury because of poor biomechanics somewhere else in the body. We want to thank San Marcos Golf Resort for having us out here. We really appreciate them being so hospitable. We were speaking today about GOLFER'S elbow and what we can do to help you at Arizona Pain Relief. Our goal as a company is to help as many people to be pain-free and live a healthy and enjoyable life, free of opioids, free of medications that are really bad for them. So if you're having GOLFER'S elbow, and you're struggling and you're not enjoying golf anymore and you're deciding to stop playing golf, give us a call. We have 10 locations in the Valley and our providers are dedicated and knowledgeable and are looking forward to helping you have the best quality of life that you can have.